just so I can do my aid it and make it real. I'm Carol. I'm the GYN service coordinator in the operating room. I have been at Froedtert since 2001. I started here as a student and have never left. I've always been in the operating room. I have been in this current role 10 years. So I'm going to talk to you today about the cystoscopy and the cystoscope that we used to use in the operating room and we've now given to your department. Very basic. Cystoscopy is lighting up the bladder to look inside to see if there's any leaks or tears or anything abnormal inside of the bladder. So there are, in this pan, your count sheet will be your friend. The count sheet has right on it the different kinds of scopes, and you're going to want to follow along. The recommended scope that most of the gynecologists use is the 70-degree scope, but there are two scopes in here, okay? So you're gonna start with that, and the by 70 degrees, I mean, it's the angle of the scope, okay? So this is a 0, and this is the 70 degrees. You can see the angle on the tip there, okay? So we're gonna start with the scope. And on the next layer, you're going to need what we call a bridge. And this is gonna go over the tip of your scope. And if you notice, there's a little notch here, and there's a little notch here. Let me get this. There's a notch there, okay? You're going to take and click it together, okay? At that point, you're then ready for the next layer. Basically, it's like a layering system, okay? So the next layer would be your outer sheath. And the majority of the gynecologists will start with this maroon colored one or the 17 diameter or 17 French. Okay, and it just snaps together, just like that, okay? We can go backwards, taking it apart, press the big button on the bottom, take the bridge off, and again, line up the notch, click it in place, and this just clicks in. All right? So that's the scope as the surgeons will need it. Now you're gonna need a couple other things for getting it hooked up to the light source and the water. We're gonna blow up the bladder or inflate the bladder with water, sterile water. And I'm hoping Jerry Ann or somebody has ordered, you just need a small 1 liter bag, okay? 1 liter bag of fluid. To get the fluid into the scope or into the bladder, you're gonna take the luer lock end and attach it to any of these channels. It doesn't matter, you just pick one, okay? So then you're gonna take your TUR tubing, which comes in a package like this. And you're going to take this rubberized end and slide it onto here. Sometimes it goes on a little difficult. It works a little better if you can just moisten the tip of it, moisten the rubberized end and put it on there. The thing you want to remember to do is close all your channels. So you're going to close this one, this one, this one, this one, this one. If you don't like your surgeon, got me on that one. The other, and then you're gonna pass this end, the red end here, off to your circulator. And this is what they spike the bag of water with. You're going to want to also close this control here. This is also another way for the surgeon to control the fluid at the field. And if you're a really nice scrub tech, you'll close these before you pass them off to your nurse. Okay, so that they can have ease of access with that. And then you're set to hook it up to your camera and light cord, except for one thing. This little adapter clicks on right here, and then you use the blue cord that comes in here. This is the light cord, and this clicks into here, like that, okay? Everybody wants to screw these on because we have screw-on light sources in the operating room, so I think they're just very used to everything screwing on, but it's all a series of clicks, all right? This is the bigger end is the end you're gonna pass off to your circulator. This will go into the light source on the striker tower. You're gonna attach a camera to this end, a regular striker camera. You know, you push down the button, slide it on, and you're set. That's it. Okay. The surgeon should know how to open the valves for getting the fluid. They're familiar with this setup. This is not anything new to them. They should not look like they've never seen this before. This is absolutely what we use in the operating room. Questions? It really is as simple as that. Now
So
you
do you
have some
any graspers or working instruments in there?
So we don't.
So
I
this is
I
just
did
for
give
them.
some to Jerry Ann. I don't know if she put them up separately or not,
Okay,
or if
there
she
are some.
decided not to. I don't know.
Okay.
So maybe there are some in your storage area. There are some other sizes of sheets. There's a 24 and a 21. Okay, if they request those. It's very rarely that they do. It'd be very rare. Most of the cystoscopies that you're going to do up here are purely diagnostic. Okay. Any other questions? I mean, I just really can't think of anything else that you have. I think you have 2 bridges in here, just in case.
How many of those
one falls.
adapters do we have? Because if we don't have that adapter, it gets lost.
So it comes in a little bin or whatever like this. There aren't. She only put one of these in there. Okay. There's some little nipples, and you need the nipples if you're going to use those working instruments that we just talked about. Those will go on these little channels here, and then the working instrument goes through that, the little hole on the channel or on the little. There are 2 stopcocks in here. Shouldn't need it for any reason, but if one drops on the floor.
So let's just say we drop that adapter.
Jerry Ann might want to put some up separately.
So she has extras?
She should.
Okay.
I think I gave her extras.
Because that's the only thing that'll stop us is if it drops or
Right.
whatever.
Right.
You know, 'cause
Yeah.
we're-
And that, maybe she and I can connect on that.
Okay.
I believe I have extra ones.
That would be
like
great.
99% sure I have extra ones
Yeah,
down
we'll
there.
take all your, whatever you're not using, bring it to us.
So that's pretty much it. You know, it's a sterile tray, just like all your other instrumentation. You want to check your indicators, have your nurse check your filters. There are some operators if they want to go in without the scope first. Some of the surgeons, I hardly have ever seen anybody do this, but they may want to go in without the scope, and that you just line up the colors, just match the colors. Okay. And it kind of goes in sideways. There we go. Like that. And they could go in without that, but most of them just go in right with the scopes and visualize what they're going to do. All right, questions? Do they want to play with it? Want to give it a try putting it together? You're good?
I'll play
Yeah,
with it.
go ahead.
I haven't done one of these in a while.
Before you leave, can you just sign my sheet so that